My name's Warwick Dawson. I'm the Pro-Vice Chancellor for Industry Engagement at the University of Newcastle, which actually is a new role that was created this year to really bring an emphasis and a focus to our industry engagement and the translation of our amazing research. Here at Newcastle, we're very proud of a long history of industry collaboration. In fact, we're the leading university in the country for industry collaboration. A very high proportion of our overall research income is generated through our collaborations with industry, which are transforming across all industry sectors. And it was one of the reasons that attracted me to the area, and I'm very excited to work with the team to develop and strengthen that even further. There's no doubt that there's amazing things happening in the region. The beauty of the Hunter region is manifold, but in particular, the clean energy transition for our nation. But there's a sense I see every day of this optimism that we can do this. We've done it before. This is a chance for us to be on the national, if not international stage, with really transformational change, in the national interest. Tipping point, we've opted to go down a path of supporting our local talent and companies, and so it's super exciting to be part of that, amazing transformation. Yeah, I think the opportunities are limitless. We have a emerging pipeline of new technologies that have the potential to be transformative for our society. So it's really to be part of the conversation, to find out what's going on, to invest, to listen to their own members who are looking, for diversification as well of investments. And so it's really to be part of the journey with us, in collaboration, and hopefully some amazing successes to come. Well, we have all the ingredients. We still need to work together. Collaboration is king here. No one piece of the ecosystem can do it alone, or at least not do it as effectively as working together. So we have all the ingredients: talented people, engaged local industry and investment community, and the government agenda and priorities and investments are now aligned. One is a risky business, and Australian industry traditionally, not always, but traditionally have been incremental risk takers. So with government, industry and universities aligned, not to mention the investment community, super funds and others, we now have all of the ingredients that we need to really transform the ecosystem and start delivering outcomes for the nation. And of course, the Australian market is one important market, but there's a global market out there as well where we really want to be making a difference. And so the opportunity for some of our spin-out companies to be located on the west coast of the US, which has, for many generations and decades been kind of the centre of the universe of that sort of entrepreneurship and innovation, will be invaluable for our spin-outs and for our technologies to get that exposure, obviously through Richard and his initiative to connect ecosystems in that part of the world, but also with regional Australia is a fantastic opportunity, and so we're really looking forward to seeing how that develops.
Hi, I'm Gerard Criss, CEO of Repair Medical Devices, based in the beautiful Northern Rivers of New South Wales, Australia. I work with a team of award-winning postdoctoral researchers and clinicians that have developed technology to rapidly repair damaged skin. In fact, in a human clinical trial of excision wounds, we were able to remove stitches within 24 hours. Normally, these stitches would need to stay in for at least 10 to 14 days. As a small Australian medtech startup, we see enormous benefits in working with the AU Tech Centre. The services provided by the centre will make it much easier for startups like us to rapidly expand into the US market. Whether it be capital raising, legal advice, or navigating the regulatory pathways through the FDA, the AU Tech team have the expertise and connections to make accessing the US market so much easier. Most importantly, they will help find strategic partners and new distribution channels for innovative Australian technologies like ours. This will reduce the time, effort and costs for us and other Australian tech companies to start exporting to the US. We look forward to working with Richard and the rest of the AU Tech Centre team to bring our innovative wound healing technology into clinics and hospitals throughout the US so everyone can enjoy faster, better healing. Thank you.
Hi, I'm Murray Cairns, CEO of PloygenRX. I'm very excited to be talking about our research and the development of our company. So I guess it started many years ago. We've been interested in complex disorders and understanding the genetics and how we might use that to better target drugs. To first of all identify new drugs, but also to match drugs more specifically to people's individual genetic profile.
So my name is Dr. William Reay. I'm the Chief Scientific Officer for PolygenRX. So I'm a geneticist. So I'm looking to try and harness the power of our genes to try and make better outcomes for people for a whole variety of very devastating disorders that affect our society.
Most drugs are developed for a specific disorder, but we know that disorders are much more complicated than that. And each individual will have a different profile of genetic risk for some of these complex chronic disorders. And so we can find, if we can identify the genetic profile that is causing a particular illness, and we can design a drug specifically for that particular profile of risk, then we'll achieve better outcomes.
So I guess what really motivates me and what motivates us at PloygenRX is the idea of personalised medicine for all. So I think there's so much interest and desire to achieve precision medicine and to personalised medicine, but it's very difficult. We have a lot of complexity, a lot of barriers to achieving this, particularly because usually we need to tailor an approach for personalised medicine on a patient-by-patient or a drug-by-drug basis. Here at PloygenRX, we've developed a very flexible platform that will allow the rapid uptake of personalised medicine by enabling us to match patients to treatments with much greater speed and efficiency than what's been available previously. Because we currently don't really have a very good way to use most of these drugs in a precision medicine fashion. Usually the doctor or the clinician will make a judgment for that person based on things like medical history and their age and so on, but these are very imprecise ways of tailoring medication to an individual. Genetics, I guess, gives us much more clarity about actually what's going on inside that person, what's the biology that we need to target in order to be able to improve outcomes for that person and increase their quality of life. Unfortunately, precision medicine is very limited in terms of its availability currently. So we need ways that we can efficiently and cost-effectively bring precision medicine to the masses. And we're really interested in the idea that we can use genetics as a bedrock or a way that we can kind of span some of the divides that are stopping this from happening and enable rapid uptake of precision medicine and allowing patients to be matched to a drug that's much more effective to them. I think that actually it's a really good thing for the pharmaceutical industry because I think it allows two things. Number one, I think that it broadens the use for their existing drugs in their portfolio. So maybe they can identify new uses for the drugs they already have or they're developing for a much wider range of disorders or patients by finding that way of targeting them more specifically. So it's kind of the idea that you may be identifying a specific user for a drug, but it may actually facilitate more flexibility to use that drug more widely. Secondly, I think it's really going to de-risk the development of new drugs. So drug development is incredibly expensive and often fails, and this is getting worse, particularly for disorders like heart disease, mental health. Drug development has really slowed to almost nothing. So I think we need a way to increase the odds that drug development is going to actually successfully run to its completion to get an approved drug by things like the FDA. So I think using genetics to understand who is going to respond or conversely, who isn't going to respond, so you can, tailor your approach more specifically, really has a massive upside to the pharmaceutical industry in terms of increasing the probability of a drug being successfully brought to market. And I think that's such a massive concern and something that I think really will have massive financial benefits as well as benefits for the individual who uses these medications.
Yeah, we're very excited to be part of this launch. We think it's a terrific opportunity for Australian startups to have a footprint in the United States where there is exposure to these large capital markets and opportunities for partnership with the leading pharmaceutical companies.
I'm Jonathan Reeves from Qforeshight, and Qforeshight is a spin-off from the University of New South Wales, and there's a group of us that founded the company. here. So Mike Shearers, he's a Professor of Actuarial Studies and at UNSW. Myself, I'm a lecturer in the School of Banking and Finance. And our backgrounds are my background is in financial risk management, financial econometrics. Mike's background is in actuarial science. Another one of the founders is Tom Park. He's got a background in commercialisation of university research. Qforeshight has developed these investment management strategies where a lot of the focus is on financial risk management. And it's geared towards investments where you have the exposure to the S&P 500 and you want to have protection against periods where you get these large negative returns to preserve your capital base. And then also in other time periods, returns are enhanced as well. So over time, these impacts compound substantially, and long-run performance by investing in the S&P 500 with this risk management system results in almost 3% above what you typically have in the S&P 500 as an annual return. And then on top of that, you've minimised these drawdowns. So depending on where you are in the investment horizon, you have these sort of protections there. And the idea is that typically with an investment, say in the S&P 500, the average returns are generally pretty high, they're around 10% per annum, but it comes with substantial risk. So you get these drawdowns, these sort of bad returns that can occur every so often. And over different horizons, up to say 5 years, you can have returns of lower than say negative 30%. So in the last 20 years, for example, there was a minus 35% return that occurred over a 5-year time period that occurred in the S&P 500. Now, when those returns happen, obviously it takes a number of years to sort of recover from that. So the idea of the strategy is, one of the aspects of it is to try and avoid those big types of drawdowns that have occurred in the financial crisis back in 2008, during the COVID period in 2020, and to mitigate that to a certain extent. And then if you're sort of protecting the value of the portfolio during that time, that adds to long-run performance. So it's a strategy that is a relatively low-cost strategy that goes as an overlay on, say, an S&P 500 portfolio, mitigates these drawdowns and enhances these returns. So on average, we've seen over the last 20 years about 280 basis points after transaction costs for the S&P 500. So we're talking about the S&P 500 on average is around, say, a bit under 10%. And so on average, you're adding about another 2.8% on top of that after transaction costs. Yeah, so it's a great opportunity to be part or be sponsored by the Australian Technology Centre, and in particular because the strategy is on the S&P 500 at the moment. It's obviously such a big market in the US, and the potential to actually form partnering relationships with investment management companies in the US.